So another issue that's important when using our area-specific curettes is making sure we're mindful of adapting the correct portion. So when we take our working end, whether it be the Explorer or the curet, we want to think about dividing it into 3 parts. So 1, 2, 3. This first part is called the first 1/3. Toe third with an Explorer, it's called the tip third, leading third, toe third. This is all talking about the same part. The middle third, excuse me, is this part, and the heel 1/3 or last 1/3 is this part. So you're always thinking about dissecting the working end into thirds, and you must always have this first 1/3 adapted to the tooth surface. You may have the middle, but this is always the priority when working on the tooth. Now, how we achieve this is by rolling the instrument between our thumb and index finger while maintaining a beautiful grasp, and very slowly we move and roll the instrument and keep it adapted to all the tooth surfaces. So you can see the direction of the instrument would be here on the direct facial. And then you can see as you start to turn, you need to roll around the tooth correctly. So this is just explaining the adaptation. So the heel third of the working end is not adapted to the tooth surface. So the 2/3 are always in contact, and in some cases the middle third are. So here, can you see what part of the instrument is adapted to the middle of the tooth surface? It's the first 1/3 or the toe third that's adapted. And this is, again, the heel third isn't adapted, and we don't really care. You don't want it flying off the tooth, but it doesn't have to be directly attached to the tooth. And the middle third here is adapted. So this would be correct. Okay, and as you in this picture, it looks like, oh, so subtly the tip isn't adapted here. So if you just roll the instrument a little bit more and focus on the tip third, it would probably be perfect. This one you can see it's definitely not perfect, and it's incorrect. This tip is off the tooth, and here we have the middle third adapted. So you always need to tuck in that tip third and keep it adapted to the tooth. So one thing that I want you to be mindful is a cross section of the tooth. So if you took a tooth, cut it in half and look at it, this is what a premolar looks like, the maxillary premolar looks like with a cross section. So in this picture, you might think, oh, I'm adapted to the tip third, because your instrument's turned all the way, but you need to focus adapting and hug the tooth with the tip third like this example. So be mindful of the curvature and the anatomy of the teeth. And different teeth require different things. So see how we need to tuck in the tip third. Always make sure that you're doing that with all your instruments. So, angulation, that is the key here with area-specific curettes. When the terminal shank is parallel to the tooth surface, you'll automatically have a 60 to 80 degree angle, and that's exactly what you want, this perfect angulation so that you're effective when removing calculus. And in that example, you can see the terminal shank is perfectly parallel to the tooth surface, so I know my face is at the right angle and the cutting edge is at the appropriate angle with the tooth. So we want to achieve ideally between 60 and 80, but that 70 degrees is perfect for calculus removal. So now, if we're working on this tooth and you have the right end and your terminal shank is leaning into the tooth too much like this, you know you're not at the perfect angulation. And we call this being too closed. The angle is closed as opposed to being open. And at this when angulation, you're more likely to burnish calculus. So what you do is kind of smother the top part of the calculus, and the burnished calculus is really hard to detect at the bottom. And then what you kind of feel is very smooth at the bottom, and then with an Explorer you'll kind of feel like you bumped off calculus, and that is a classic burnished calculus feel. And it's usually due to if a clinician uses hand activated instruments, the angle was not perfect and too closed. So at this ideal relationship between 60 and 80, the shank is parallel to the tooth surface, so this is going to result in effective calculus removal. Now, in this example, on this part of the tooth, we have the instrument, the terminal shank is too open. And we use the term open, we say the angulation is too open, so it opens a space. The terminal shank should be hugging the tooth, but it's opened space. So we call this too open, and it will result in tissue trauma. Okay, so down here you can see the curet is hitting the sulcus and causing trauma. So you don't want to be too open. So it's kind of like Goldilocks. You want to be perfectly parallel and not too closed and not too open. So here's just another example of a close-up of showing you what happens when you have too much angulation and too little, and results in burnishing calculus. So we want it just right so you can remove those deposits. So now a very common hand motion that you'll need to make is pivoting. And you want to basically balance on your fulcrum and swing and move with that fulcrum finger so that you're lying down on the tooth surface and pivoting up. And this is going to help you with creating the perfect angulation around the teeth. So strokes. So with area specifics, you'll be doing exploratory strokes until you feel resistance. With calculus, then you'll do an activated stroke or working stroke or calculus removal stroke. And that is basically applying lateral pressure and that you're pulling coronally. And then with that particular stroke, it can move in different directions. So you can move obliquely, vertically, and horizontally. So here's a vertical motion where you're actually going up and down in an apical coronal direction, and you've been doing this with the Explorer. And basically we do this interproximally. Is very important to have a vertical stroke. Now an oblique stroke is very important. We're moving at a diagonal, and you'll find you need to do this in particular on the distal line angles. As you're coming around mesially, you'll start obliquely because it'll be hard to get the tip third of your instrument on that line angle without distending or hurting the tissue. And as you come mesially, you turn it into more of a vertical stroke, and you avoid that diagonal direction when coming into proximal. This is a horizontal stroke where you can actually go toe down, and this can be very effective. especially on interior teeth, on direct buccal and linguals. At this point, I would think it's an advanced move, and you want to be really mindful of when you're doing this direction. So right now, it might be more by accident, but we will teach you how to do a horizontal direction and stroke once you feel a little more comfortable with curettes. So channeling, this is basically when you're removing calculus, you want to remove small, very small sections and do overlapping strokes. And that's going to be important, especially when it's subgingival, because you can't see what you're removing. Lateral pressure. This is referring to the pressure that's created when the force is applied against the surface of the tooth with the cutting edge of a curet blade. And the force can be generated in two ways. Finger flexing and wrist rocking. And obviously the wrist rocking is what we'd like to promote. So we've been doing the wrist rocking with the Explorer, and we do this by pivoting on the finger rest or the fulcrum, and this is going to help you transmit the power of the stroke from the forearm and the cutting edge to the tooth surface. You can also rotate your hand and wrist and move it as a unit, and this is going to provide the power for your stroke, and it's less tiring when you do wrist rocking as opposed to finger flexing. And we use this motion with all hand activated calculus removal instruments. Now, finger flexing is almost more of the motion you use with probing, and you tend not to want to do this when you're scaling. This is when you're just using your fingers. It can be more tiring, and you tend to have less power. And it's fine if you don't need a lot of strength, like with probing, you need no strength for that particular skill, so it's fine. Areas when you have a restricted movement and you can't wrist rock, or you're in a delicate area like furcations, or doing advanced things like a toe down on line angle. These particular areas we tend to finger flex because you need an extreme amount of control, but it also can be a bad habit. So we discourage using finger flexing technique until you've really established your wrist rock and you feel real comfortable. So finger flexing isn't the best ergonomic decision, and it's a bad habit to get into. So we like to avoid that early on. So lateral pressure. But basically, it's going to vary depending on the mode of attachment, and you're always going to use an exploratory assessment stroke with your curettes until you feel calculus. So that's super important. You don't want to be heavy-handed doing, firm lateral pressure when your patient you're only removing biofilm. So something to be mindful of. And you'll want to practice all various types of pressure, firm, moderate, and light. And sometimes when we're practicing with heavy lateral pressure, if you are slipping, that's some insight that you might have a couple of mistakes that are happening. So sometimes it's good to practice on your typodont with heavy lateral pressure, because it might mean your instruments are dull. It might mean you have, if it's not working, it might mean you have the wrong end. If you're slipping, you could have your instruments aren't sharp. You might most likely are not on the tip third. So it can, you'll want to help you problem solve and figure out what's going on and what's wrong with this problem. Or it also can be that you just don't have enough pressure on your fulcrum, and that's when you find out you really need a lot of pressure on your fulcrum when you start using curettes. So our assessment or exploratory stroke, we always use that. You're evaluating the tooth surface, especially subgingival, since you can't see calculus. So you're using exploratory stroke to try to find any calculus. And the lighter your grasp is, the easier it will be to detect any calculus that might be there. When you feel deposit, you want to make sure you're opened and you're perfectly angulated and your terminal shank is parallel to the tooth surface, and then you'll apply a little pressure and activate a stroke and try and remove the deposit. So a calculus removal or working stroke, it's used to remove calculus deposits. It's short, it's controlled, it's like a biting stroke into the tooth, and we use some moderate pressure. So you want to control and stop the stroke by pressing down on the fulcrum finger. Sometimes people use all this pressure and it gets away from them and they fly off the tooth. It is a short, controlled stroke. And you alternate then with an assessment stroke until you feel deposit and then activate. So it's on-off kind of a thing. So a root planing stroke, which I've talked about, it's more a longer, lighter, very light pressure. You need very little pressure to actually remove cementum, and you must be perfectly parallel. So this slide is just showing you the importance of using proper lateral pressure. So many times it's easy to miss the base of the pocket. So this here is showing you need to start at the bottom of the pocket, and here is showing you choppy or uneven or inconsistent with lateral pressure, and this is showing you too many heavy strokes. And sometimes this happens because in the beginning of the stroke, you might not have much momentum. In the middle of the stroke of a wrist rock is the highest, easiest time to generate the force, so people tend to really lay into it in the middle of the wrist rock. So this is really just showing a bad habit of being too aggressive in the middle of a wrist rock. And if you do it over time, you'll take away the tooth structure. So these are all bad examples. So sometimes if scaling too much over a period of time, you can end up what they call cokebottle roots. So you don't want to create those. So tactile sensitivity is going to be important, and that's the ability to detect calculus deposits from feeling vibrations that are transferred from the tip of the instrument to the shank and to the handle. So you'll want to use your tactile sensitivity to locate the deposit with the toe third of the instrument before you begin your calculus removal stroke. And again, the lighter you hold your instruments, the easier